The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents CMC Joint, aka Basilar Joint Arthritis of the Thumb by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I am a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In today's video, we will be discussing CMC joint arthritis, or basilar joint arthritis of the thumb. In a previous video, we discussed arthritis of the hands, fingers, and wrist. Although this is such a common arthritis, I really wanted to do a dedicated video here to give patients a little bit more information about CMC joint arthritis. So we're going to talk about how to diagnose this, how to treat this, and what this is. Essentially, we're going to give you some simple home diagnostic tools as well as some simple home treatment remedies which may save you that initial trip to the doctor's office. So in the previous video, we really went into detail about the differences between osteoarthritis and rheumatoid arthritis and post-traumatic arthritis, and then the other types of inflammatory arthritides we touched on a little bit. Arthritis at the basilar joint of the thumb, or CMC joint arthritis, those terms can be used interchangeably. That is very typically an osteoarthritis, which is just a general wear and tear arthritis. Again, this is the second most common place in the hand to develop arthritis after these little end finger joints called the DIP joints. But this tends to be the most painful arthritis in the hand and wrist that I see as a hand surgeon. This joint tends to wear out starting in the fourth and certainly in the fifth and into the sixth decades of life because there's so much mobility in this joint. It's where we get the opposition of our thumb from. This joint just tends to wear out with time and certainly with heavy activities. Patients will complain of pain kind of in this whole area. Sometimes it's a little vague and a little difficult to pinpoint. They'll complain of weakness with gripping, grasping, pinching, twisting doorknobs, twisting jar lids or pop bottles, for example. Something that you can do to help self-diagnose this is really pinpoint exactly where your pain is. Is your pain coming from here, the MP joint of the thumb? Are you having any clicking or catching of the thumb? Sometimes that's a tendonitis called a trigger finger, particularly if you're tender here. Is your pain coming more up here in the wrist? This can be associated with a tendonitis called de Quervain's tenosynovitis. Or is it truly at the CMC joint or the basilar joint of the thumb? So follow this bone down to where the thumb bone meets the wrist and really give a deep push or deep palpation into that area. That's typically very painful and sore in patients with CMC joint arthritis. Something else you can do is called a CMC grind test, where you push that thumb towards the wrist and kind of grind it into the wrist. That typically elicits a lot of pain in patients with CMC arthritis. Occasionally as well, you'll actually feel or hear a grinding sensation. That is arthritic bone or bone spurs grinding against one another. Also, be mindful of overlapping carpal tunnel syndrome. Occasionally carpal tunnel syndrome, which can cause pain into this whole aspect of the hand, can be confused for basilar joint arthritis. But typically there's no numbness or tingling associated with basilar joint or CMC joint arthritis. What are some other diagnostic tools if patients come to see me in the office? Obviously, we get x-rays. Almost all orthopedic patients with a new complaint of pain will get an x-ray. The x-rays show me and tell me a couple of different things. Is there any deformity in the bones, such as arthritis? We can see that very, very easily due to narrowing of the joint spaces. So as the cartilage wears away, the bones appear closer together, and that's what arthritis looks like on x-ray. We can also see fractures, or we can see evidence of old trauma or old fractures, which may be leading to a post-traumatic type arthritis. In the office, other other things that we can do diagnostically if the x-rays are normal and patients have kind of a vague pain in that area. Occasionally we will order an MRI, which shows me the soft tissues surrounding the joints. And if there is any numbness or tingling associated with it and we're concerned for carpal tunnel syndrome, we'll do a full workup and evaluation for carpal tunnel syndrome. You can see one of the other videos to educate yourself about that. And occasionally we need to order a nerve study to evaluate for carpal tunnel syndrome. So treatment recommendations, some of the simple home treatment remedies that patients can try. And again, if you've watched some of the other videos, this is reiteration of some of those treatment recommendations. But non-steroidal anti-inflammatories such as Aleve and Motrin can be very helpful. Of course, check with your primary care physician and make sure that you can take those medications safely. When patients come to see me in the office, oftentimes that is the first line of treatment that I offer. And ibuprofen and Aleve come in prescription strength, and I write for those medications very routinely. A brace can be very helpful for this particular arthritis. It's called a thumb spica brace or an opponent's splint. You can order this online. If you want to get the opponent's splint, that actually allows you mobility of the wrist and the fingers and the tip of the thumb, and it just immobilizes the arthritic CMC joint. Or you can go to your drugstore probably and buy a bigger thumb spica brace. And this is a wrist brace essentially that starts here and it comes up and around the wrist, but then it encompasses the thumb.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.